Hello and welcome to How Positive Are You? This is a podcast series where we explore the mysteries of HIV and AIDS from a skeptical, free-thinking point of view. I'm David Crowe, president of Rethinking AIDS, calling from Calgary, Alberta, Canada. And I'm assisted again today by my co-host Elizabeth Ely in New York City. Hi, Beth.
Hi, David. How are you?
I'm doing great. Today we have a great show for you with a great guest. In fact, I know him very well. You know him very well. I think our listeners know him very well. It's David Crowe, who also runs the Alberta Reappraising AIDS Society. That would be me.
Yes, and David is going to talk about so-called HIV criminalization in Canada, laws and legal precedents that send people to jail for supposedly transmitting HIV to another person through sex. Because it turns out that our very own David Crowe has been active over the past decade or so, talking to defendants and their lawyers about the possibility of debunking HIV science in the courtroom. How's that going, David?
Well, to be honest, not so well so far, although I'm always optimistic for the future. We either can't get the interest of the lawyers, we can't get the interest of the defendants, or the defendants don't believe that we have anything to say. We've learned a lot, and I hope that in the near future we will have some really good cases in Canada that will move the ball forwards.
I hope so. Here in what you guys call the States, or the Statesy, we've seen a lot of media attention, mostly sympathetic to the defendants.
Defendants?
Yeah, mostly sympathetic to the defendants because they want to repeal these laws.
Okay.
And we've even seen one organization, the Office of Medical and Scientific Justice, for which I can disclose right now that I do a bit of outreach work for. We've seen it help about 52 defendants so far by providing or even threatening to provide expert witnesses as to just how unsupported the so-called HIV test is. As the tests themselves, they find neither actual retrovirus nor antibodies specific to that retrovirus, and the disclaimers inside the packages actually warn against using them for diagnosis of any disease. So, to anyone new to this podcast series, I suspect this information might be shocking. After all, isn't a diagnosis of HIV positive supposed to mean you're infected with a deadly sexually transmitted disease?
Well, according to the Supreme Court of Canada, that's what it means. But what was really interesting is last year we had a big Supreme Court decision on HIV criminalization. And although they had expert reports and they had testimony from so-called experts, they actually didn't use any of that in order to declare that HIV was a deadly virus. They basically just said that that's the way it is.
Uh-huh.
And we all are supposed to believe that.
Sort of a everybody says defense.
I can quote from the Supreme Court decision, which was late in 2012, October the 5th. It says, "It is enough to note that HIV is indisputably serious and life-endangering."
Well, you know, that here in the U.S., they're taking kind of the opposite tack. The actual mainstream AIDS organizations are saying, well, it's not that bad because you have really good treatment options nowadays, and if you have a low viral load and maybe you used a condom, it probably should just not have these books on these laws on the books. But let's just say these tests aren't standing up in court when they're actually brought up with expert witnesses, which hasn't happened so far in Canada. As you say, it's just kind of an everybody says defense. So right now, in June 2013, the celebrated case of Nishan Williams, which we covered in episode 64 of this series, is now also uncertain because it's unclear whether he's HIV positive or not. It is unclear that he's HIV positive. I mean, that's a big bombshell here in New York.
That's something that has not been raised in these cases. There was no question in the Supreme Court transcripts. The statement of the Supreme Court, the decision of the Supreme Court, didn't say anything about whether or not the two defendants they used in their precedent-setting hearing, they didn't say anything about whether they were really HIV positive. They just assumed that they were.
Right. Well, I just would like to mention for our audience, if they are listening before June 17th, that the Williams case does go to trial on June 17th. That's this coming Monday in Mayville, New York, about 60 miles south of Buffalo. And we hope that they'll either be there or be checking the news from afar. The actual trial, however, will be closed to the public. So all you can do is stand outside and let people know how you feel about it. Um,
Why would it be closed to the public?
I don't know. I guess it's a little bit embarrassing to find these allegations come up in court. I mean, that's just my speculation. The allegations that he might even just be HIV negative. And also, it was a hugely publicized case about 15 years ago. So, the whole media circus around it probably spoke against having that kind of media circus again, especially since it doesn't work in the state's favor to have the same kind of media circus around getting this guy out of jail as what put it in jail. I grew up on the Canadian border, and my family owned a bar, and we sold beer to Canadians. And if there's a better business to be in, I'd like you to let me know. We managed to go broke doing it somehow, but we had an image of Canada, I remember, and the image of Canada is pretty uniform, I think, in this country, that it is a clean, polite place with clean cities, a low crime rate, ethnic diversity from very open immigration policies over decades, and, in short, kind of a better version of the U.S. And then occasionally we hear shocking news from there, including recent allegations that the mayor of Toronto is a crack smoker, very shocking child sexual abuse scandals, horrible treatment of the natives, and so on. I mean, in your opinion, David, are there hidden hysterias in this nice country we call Canada?
Yeah, whenever we mistreat a group, everybody else sort of keeps quiet. So the natives were in residential schools where they were physically and sexually abused for decades, and the nice white people didn't say anything, and we interned the Japanese in the Second World War, just like our friends south of the border. We interned Ukrainians in the First World War. There are many bad things that have happened in Canada. I have experienced personally a lot of latent racism, not against me because I'm, white, English. I'm not seen as a group to despise, but people feel they're safe with me to express their feelings about Pakistanis or natives or gay people or whatever. So I've heard a lot of things from the mouths of other Canadians that are really not very nice. But in public, we tend to be very polite. So we don't walk around talking like Rush Limbaugh or something like that. But we might think those things, and we might treat people badly because their skin color is different or they're a different religion or something like that.
Right, right. I guess that where I'm coming from in this question is that I don't see all-out hysterias as in calling for someone to go to jail for having sex and passing HIV under some pretty flimsy science. I don't see situations like that where there's overwhelming hysteria as just people sitting around a country club sharing with other white people how they hate black people or something. I really think there's some hidden tensions that drive societies to hysterias that way, to that kind of behavior, including those that turn public opinion overwhelmingly against HIV positives being accused of these crimes. I mean, the media coverage of these is really quite a circus. So, if you could speak to maybe the kinds of hidden tensions inside Canadian society, not just the results of them, the abuse of children and things like that, but what kinds of things are under the surface in Canada that make it kind of an insecure society sometimes?
Well, that's a pretty deep question, and I'm not sure I know exactly why people with HIV are treated as harshly as we used to treat the natives or blacks or Japanese or whatever. I know, I guess it was most clear in the case of Carl Leone, but this is true of, I think, all the HIV cases. The press has utterly demonized him. They make comments that, put him in jail, throw away the key. He's a monster. He's despicable, depraved. And basically, in these cases, in the case of an HIV criminalization case, if you took HIV out of the picture, the man and sometimes a woman would not have done anything wrong. So, in other words, if a man has sex with 20 people, 20 women, maybe some of them are prostitutes, some of them are drug addicts, some of them would be classified as girlfriends. A variety of different women. This man's would be promiscuous, but not breaking any records for promiscuity by any means. And if he was HIV negative, it would be considered his private business as long as all the people were of age and they were all willing partners. Then it's considered his business and the women's business who they have sex with. But as soon as he is found to be HIV positive, he becomes a monster. And so basically, HIV is a criminal offense in Canada because if you take HIV out of the picture, there is no criminal action. So in effect, this is not written into the law, but in effect, HIV is a criminal offense in Canada.
So there are no specific laws specifying HIV, but they use other laws to enforce a kind of prosecution of HIV positives?
Yeah, that's an extremely important point. There is no law that says it's illegal for an HIV positive person to have sex with another person without revealing their status. So the way that it works in Canada is kind of convoluted, but it uses the laws of fraud, which seems very strange, but the logic is something like this. So a man and a woman have consensual sex. They agree to have sex. Usually the woman does not know that the man is HIV positive. Sometimes it's the other way around. So one partner does not know that the other is HIV positive. According to the law, you have obtained consent fraudulently because under the assumption that HIV is a deadly illness, they assume that the HIV negative partner would not have agreed to sex if they had known that their partner was HIV positive.
Right, and this is different in cases of, say, other sexually transmitted diseases like gonorrhea or chlamydia or syphilis. I mean, that those aren't considered life-threatening. Is that the difference?
I think that's the difference. That HIV is considered fatal in every case, even though we know that it's not even by the establishment's own standards. But that's basically the standard that they take. So what we have is we have consensual sex, but we've waived the consent. We've what they call vitiated the consent. We've taken consent away. So sex without consent is called sexual assault in Canada. If you use a weapon in a sexual assault, that's aggravated sexual assault. So HIV is a deadly virus according to the courts. Therefore, the sexual assault becomes aggravated sexual assault, which is an extremely serious charge. You're getting sentences getting up towards life in prison. Then, if somebody dies due to an aggravated sexual assault, that is automatic first-degree murder. Normally, you need to prove intent, but with an aggravated sexual assault that ends in death, it's automatic first-degree murder. So in the case of Johnson Aziga, the only case that I know of an HIV-positive Canadian man who had, I believe, 2 partners who were later found to be HIV positive. They went on the drugs. They died of a drug side effect, and he was then charged and convicted of first-degree murder and is serving a life sentence.
Wow. So what's the actual statistic on how many sexual encounters you have to have with a single person to supposedly transmit HIV? This is according to the mainstream.
Well, the Supreme Court actually did us a favor by referencing a 2009 meta-analysis, and a meta-analysis just means a study of studies. It's not gathering its own data. It uses other studies as its data. And they went around the world and they looked at studies that tried to find out the per contact risk of HIV through one incidence of sex. And one thing we can learn from this is that the estimates are all over the place. From very high, one estimate in Cameroon in Africa was 8%. Others are essentially 0. And so you have to say there's something big going on if you're all measuring the same thing, and you're coming up with estimates that vary probably by a factor of 1,000 or more. There has to be something wrong, something you're missing. Um, Maybe, for example, you're not actually looking at a sexually transmitted illness. What you're looking at is antibodies, and you're basically looking at the rate at which people acquire antibodies in a particular population.
Right. It has nothing to do with sex in that case. There's too many other factors, and it's an antibody test, as I mentioned earlier.
Yes, I mean, what they found in this Lancet study was that in Africa, the estimated per incident of sex risk was close to 1%, but the male risk was about one quarter of that. So, in other words, women in Africa are 4 times as infectious as men, but in rich countries, men are twice as infectious as women.
Hmm.
This study came up with an estimate that was considerably higher than the Padian study, and in fact, they didn't even reference the Padian study
The
in this
Padian study,
meta-analysis.
can you explain what the Padian study is for our audience?
Yeah, the Padian study followed serodiscordant couples. That's one positive, one negative, over a period of about 10 years.
And this was in California, was that
Yeah, it
correct?
was
Yeah.
California.
Okay.
They published the data in 1997, so I guess the data was gathered late 80s, early 90s, up to
Hmm.
the mid 90s. And they found zero cases of seroconversion. That is, that in not one case did the HIV negative partner become HIV positive. And so from that, you can estimate that the risk of sexual transmission of HIV is zero. So then they said, oh, well, that's not any good because that's not what we wanted to find. So let's go back and look at the partners who were both HIV positive at the time we started the study. Let's estimate when one partner became positive, estimate which was the one that infected the other. Let's assume that the infection was between the two partners, and from that, we can calculate what the risk of sexual transmission is. They calculated about 1 out of 1,000 for a male having sex with a female, and about 1 out of 10,000 for a woman having sex with a man.
Okay, still less than 1%.
Yes.
I mean, that's pretty low. Well, you said these were serodiscordant couples. Were there some that both of them were positive?
No, okay, let me explain again. So in the
Yes.
serodiscordant couples going forwards from the start of the study, they found no cases of, in ironic quotes, infection. Okay,
Right.
so so based on the forward-looking portion of the study, they found a risk of sexual transmission of zero. But because they didn't want to find that, they then went back to the beginning of the study and they said, okay, there were other couples in our study who were both positive by the start of the study. So let's do a retrospective study. Let's go back and we'll assume that in the case of this man and this woman, we'll assume the man infected the woman, that they've been living together for 5 years. We'll assume that the infection occurred, 5 years ago, something like that. And so based on a whole list of assumptions, including the assumption that men are more likely to infect women than the other way around, based on all of these assumptions, they calculated that if a man who's positive has sex with a woman, there's a 1 out of 1,000 chance of the woman becoming positive, becoming infected. And if a woman who's HIV positive has sex with a man, there's a 1 out of 10,000 chance that she will infect him through one incidence of sex.
I
Now, for
see.
some reason, the Lancet study did not mention Padian. Uh, and even if they had, the Supreme Court of Canada took an extremist view about what constitutes acceptable risk. So they
Well,
basically
yeah.
said it has to be essentially zero. And the standard that they had was that if you don't disclose that you're HIV positive, and of course, if you disclose it verbally, you have the risk that your partner will say that you didn't. If you don't disclose, then you have to have both an undetectable viral load and have used a condom. But again, using a condom is some information that's generally shared only between sexual partners. So if your sexual partner says afterwards, no, you didn't use a condom, there isn't much defense.
Wow. Yeah, that's strange that Supreme Court decision, the Canadian Supreme Court decision in 2012 cited low viral load and use of condoms as a factor in not charging people or not convicting them. And I noted that in the US, there's also a tendency to rationalize a loosening of these laws because of supposed treatment advances and other scientific nonsense. I mean, they're basing it on junk science about viral load and these junk statistics that you just stated, and even assuming that even their use of condoms is going to make a difference in a 1% or less transmission rate. Anyway, it's just tinkering with this stuff because, as I see it, they just don't want the whole system to come crashing down when these things get to court. And people start challenging the diagnosis.
Yeah, I mean, I think from the doctor's perspective, a doctor would say, well, look, if our patients, if we educate our patients on compliance to their drugs, if we have proof that they are compliant to their drugs, if we educate them on the use of condoms, and we have some proof that they are using condoms, then we're happy because they're following our orders. And then we don't think they should go to jail. But if they say they don't like the drugs because of the side effects, which the doctors basically deny exist, or if they don't want to have sex with condoms, then they should go to jail for the rest of their lives.
So you're
Doctors are
saying
okay with that.
they're not exactly enforcing a Victorian view of sexuality, but they are enforcing a kind of mind control about what they say is HIV science.
Well, yeah, I mean, if you're an HIV positive person, you would have to take every dose of your drug. You would have to go regularly get a viral load test. You would have to use condoms every time you had sex. You would have to report any problem with the condoms, such as the condom slips off or breaks or whatever. If your viral load shot up for some reason, and who knows what viral load means, so it's quite likely to happen, you would then have to become celibate until you had an undetectable viral load again. So you would be living in this dictatorship of medical tests and medical procedures, and that's the only way that you could survive as a sexually active HIV positive person. And of course, if you're taking the drugs, I don't know how long you'd stay sexually active, because I don't really think that AIDS drugs taken totally compliantly are compatible with good health. So you'd probably lose the capacity to be sexually active or the desire to be sexually active after a few months of strict adherence to your antiretroviral regimen.
Exactly. Yeah. Strange kind of fascism going on.
Yeah, can I describe one of the cases which I found quite interesting? It was
Oh, sure.
the way that there's sort of three factors to the Supreme Court hearing. In 1998, in what's called the Courier precedent, the Supreme Court of Canada said that you should either disclose or you should be of low infectivity and use a condom. But they weren't very explicit about exactly what they meant. And so there were challenges to that precedent. It's not a law, it's a legal precedent. And so we had this hearing in 2012. And they chose two cases to hear as part of the hearing, two cases to consider. One of the cases actually involved a woman, which is quite unusual. And the circumstances were something like this. It's really a bizarre situation. So the HIV positive woman meets this man. They have sex. She then reveals that she's HIV positive. The man freaks out, but later they reconcile and they enter into a long-term relationship. I think the relationship was a little tumultuous. I believe he was physically violent. And after some time, the woman decided to leave. When she went back to where they had lived to pick up some of their stuff, he beat her up quite severely. She called the police, and he was charged with assault. So then, this is several years after the first time that they had sex, which is the only time before he had been told that she was HIV positive. He then reported to the police that she had had sex with him without a condom back 5 years ago or whatever, and managed to get her charged with aggravated sexual assault. So here you have the violent person, basically turning the tables on the woman who complained about his behavior.
It sounds like Nicole Andrews, whom we interviewed some episodes back.
Yeah.
Yeah. And also, I would note that was he still claiming he had not known she was HIV positive for all those years? I mean,
no.
Non-disclosure is really the smoking gun here, and
No,
he didn't
no, he
even
was
have to
not.
claim that.
No, he basically admitted that he had known after the one incident that she was HIV positive, and he willingly had unprotected sex with her over a period of several years. But when she turned the tables on him after he assaulted her, or when she accused him of assault, he turned the tables on her. Now, she was, I believe, convicted in one court. It was overturned on appeal, and then it went in front of the Supreme Court. Now, the Supreme Court said her viral load was low at the time. She claimed she used a condom. He claimed she didn't, or he claimed they didn't. I guess he was the one using the condom. He claimed there was no condom. She claimed there was. The Supreme Court basically said, in the case of he said, she said, the defendant wins. So they said that because she was low viral load and had, in their opinion, used a condom, she was okay. And then beyond that, she had disclosed her status, so it was okay beyond the first incident. But in the other case, it was a man who had, I believe, 9 women who he had had sex with, none of whom became HIV positive. And he had been convicted on, I believe, 6 counts. And the Supreme Court took away one of those counts because the Supreme Court said there was evidence he used a condom, and at that time his viral load had been low. But in 5 out of the 9 cases, his viral load had not been low. Even though he'd used a condom, he was still convicted. So I don't know what the sentence for Clayton Mabior was adjusted to, but I would imagine it's many years, probably somewhere between 5 and 10 years in jail. So this illustrated the extremely strict standard, and basically, if you're accused by more than one person, the likelihood is that with one of those people, your viral load was not low, or there's dispute over whether you used a condom. And if you had sex with 5 women, for example, and all of them said you didn't use a condom, it doesn't matter if all of them were lying, you will probably be convicted, because they will say if it was one woman saying you didn't use a condom, we might not believe that, but all 5 of them, that's hard to believe. So it's an extremely rigorous area, and I think it's ripe for an organization like OMSJ to come in and start asking some tough questions, like why did the Supreme Court rule that HIV was a deadly virus without any evidence? It is enough to note that HIV is indisputably serious and life-endangering.
Right. But as you say, neither OMSJ nor your assistance has been requested in any of these cases. I mean, why aren't the defense lawyers in these cases more enthusiastic about questioning the HIV diagnosis themselves, as has been done many times in similar cases in the U.S.?
Well, let me talk about 3 specific cases that I can mention. I've mentioned Johnson Aziga. He was charged with aggravated sexual assault, which is the standard procedure, plus, unique to him, first-degree murder. So Stephen Davis, who you're probably familiar with, author of a couple of books on HIV, and I went to Toronto.
Oh, yes.
We met with the defense lawyers, and the defense lawyers were really very interested. We had about half a day with them, and they were totally fascinated by what we were saying, and they really got it. They really understood that there was a big problem here. So we were really, really excited. The defense lawyers had to then drive from Toronto to Hamilton a few days later to visit their client who was in jail, and Johnson and Aziga turned around and fired them. So that was the end of any assistance to Johnson and Aziga. I believe Henry Bauer talked to one of his subsequent lawyers, but the subsequent lawyer, I guess, figured he had a bulletproof defense. It resulted in life imprisonment for Johnson and Aziga, so I guess it wasn't exactly bulletproof. And it's quite likely in Canada, although life imprisonment is 25 years, I believe Johnson and Aziga was about 50, so potentially he could still have some life left after he gets out of jail. But they also have the ability in Canada, like in the United States, that if somebody is a sex offender, they can declare them dangerous and keep them in jail forever.
Right, that's what I understand. They're trying to get renewed in the Nushan Williams case, where he has actually 2 years ago served out his complete sentence, but he's still in jail. So they have these same kinds of situations in Canada?
Well, no, Nushan Williams is different because they're trying to put him in a mental institution.
Oh.
right? They're not in Canada. He would be declared a dangerous sex offender,
Hmm.
and
Same
would
as
be,
here.
but he would be put in jail for the rest of his life, not a mental institution. So there is a difference. Although I'm not sure in from the point of view of the person who's sentenced to life behind bars, it doesn't matter whether it's the bars of a mental institution or a prison. I'm not sure it makes
Yeah.
a lot of difference.
Well, actually, from our last interview with Tom Chevery, he did say that it's probably worse to be in a mental institution. You know, that's just
Yes,
the reality of it. So, but the point is that they do have in Canada these laws that can keep you under lock and key beyond your legal sentence if the crime that you're you're convicted for involves being a sex offender. So that's
yes,
another kind of arbitrary thing.
right. In the case of Carl Leone, which is the second case I'd like to talk about, which was in Windsor, um, after they convicted Carl Leone to 18 years in jail, and if you add in the 3 years prior house arrest, that's really a 21-year sentence, which is getting close to what we call life in prison in Canada.
This guy was some kind of a monster for having sex with 13 women or something, or I thought I heard 18, over the course of maybe like a couple of years, maybe even more than that. I really doubt that that's excessive. I mean, I wouldn't even call it promiscuous. I would just call it having a good time. But basically, they turned this guy into a monster. I mean, it was strange.
Well, yeah, when it comes to light that you've had sex with 18 people, all of a sudden you become a monster. But if a guy, went to university, or a woman, and after 4 years of university counted up that they'd had sex with 75 people, that wouldn't really be anything extraordinary. But that's all secret. Like nobody really knows how many people, uh, undergraduate university students have had sex with over the
Yeah.
period of 4 years if they're so inclined.
Yeah. Do we know what's normal? What's the
No,
benchmark for people at any given age? I mean, what's normal? What's normal in the U.S. and what's normal in Canada? People lie all the time.
yeah, I mean, some people go to the bar every weekend and try to get lucky, and if you get lucky 20 times a year, that's not that many times, and over 10 years, that's a lot of sexual partners. In the case of Carleone, they had a hearing to try to see, to try to have him designated a dangerous offender. And if he was designated a dangerous offender, he would not ever get out of jail until the condition that made him dangerous was removed. So, for example, if you were a pedophile and you were classified as a dangerous offender, if you could prove that you no longer had any desire to have sex with children, you could get the dangerous offender status removed. But if you're HIV positive, how would you possibly get the dangerous offender status removed? Now, luckily, Carleone was not classified as a dangerous offender. It might have been the first time in Canada that it was ever applied in a first-time offense, because normally you're talking about a person who gets, a short sentence for having sex with a child, and then before you know it, is in front of the courts again, and it gets more and more serious until they eventually say, look, this guy's not going to stop molesting children, so we have to put him in jail for the rest of his life. But in Carleone's case, this was conviction for his first offense. But
Mm.
in Carl's case, talking about the difficulty working with lawyers, I spent close to a week in the office of the lawyer. I read witness transcripts. I read a whole pile of documents, evidence that was involved in the case. I wrote up reports on possible questions to ask the witnesses, summaries of information. I read what was called a phylogenetic report on the genetic sequences of Carl versus the women in the case. And then I went home on the Friday or the Saturday, and on the Monday, Carl phoned me to tell me that he was pleading guilty. And I believe it was under pressure from the lawyer, who did not want to go up against the establishment and say, oh, by the way, there's something really wrong with this whole HIV theory.
Right. I mean, it really hasn't been proved out in Canada yet. This would be the first
No,
time if they did it.
yeah, I mean, I think the lawyer said to him, I'm just guessing, but I suspect the lawyer said to Carl, and Carl, even though I talked to him, has never really told me what happened. But he's implied that the lawyer said, "Look, this is going to bankrupt your family. If we proceed with this, it's going to take forever. It's probably going to go through multiple levels of appeal. It will be the end of your family. So it'd be better for you to throw yourself on the mercy of the courts and just take the sentence you get, which was 18 years, which isn't terribly merciful, in
Yeah.
my opinion."
Yeah, well, in New Sean Williams' case, they were threatening something like 75 years behind bars. So he did the math, and they said if you plead guilty, we'll just give you 12, 4 to 12. That looked like good math. I mean, 18, I don't know what that was compared to.
In America, they have this thing where you can be sentenced to absurd lengths of time, like 500 years or something if you do enough crimes, if you're a mass murderer or something. But in Canada, they seem to cap the maximum sentence at 25 years. Um, the third case I was involved with in a significant way was the case of Charles Mazite in British Columbia. So I went out to Victoria to visit with the lawyer, John Hardy, who is a dentist who was the first who was asked to investigate HIV in the 1980s and concluded that it was not a risk to dentistry, and actually wrote a very difficult to obtain but very good book on infection risks in dentistry, with a really good section on some of the situations around HIV, which is essentially a dissident book. And a friend of Charles Mazite, who's also basically a dissident. We went to see the lawyer. The lawyer understood what we were talking about. We had a really good discussion, and we talked about all the weaknesses in the HIV/AIDS theory. And at the end, he said that it's all very interesting, but he has a bulletproof defense. Charles Mazite was never properly informed that he was HIV positive. There was questions about whether he was actually received the message, whether he went back to be given the information that they won't give over the phone. And because he had such a bulletproof defense, he didn't really need to use the dissident arguments in court.
Did that turn out to be true? Did he have a bulletproof defense?
Not really. Charles Mazite got about 10 years. Another interesting thing about Charles Mazite is that Charles Mazite was a dancer and a drummer. You can't find a more fit person. So here you have this person who apparently was diagnosed HIV positive in 1996, and we're talking well over 10 years later. He's as healthy as a horse, could dance most people off the stage, and yet he's got a deadly disease, and he's accused of trying to transmit that deadly disease to women. And because Charles Mazite is an immigrant from Zimbabwe, he will be deported back to Zimbabwe after he serves a sentence.
Yeah, you have actually alluded to, sort of indirectly, some ethnic aspects to these cases. I mean, these are obviously like African names, and in the case of Carl Leone, I think you've mentioned previously to me that there was this hysteria about him being Italian Canadian, which to me seems rather strange. Is he?
No,
Yeah?
there was nothing made of the fact that he was Italian. I think Carl Leone is an outlier. In most of these cases, like New Sean Williams, Charles Mazite, Johnson Aziga, we're talking about black people.
Or from Africa itself, right? Yeah.
I think there's still a lot of fear amongst white people that black men are out to rape all their women. And I think the reality is quite the opposite, but that's sort of an embedded, almost genetic fear in white people.
The reality is the opposite in what way?
Well, that white people have probably raped a lot more black women than black men have raped white women.
Well, that's certainly true in the southern U.S. in our history.
Well,
yes.
Yeah.
Yes.
I mean, it's the pot, calling the white ceramic plate black, I think.
Yeah. Yeah. It's strange. It's there's this fear in North America in general, and probably in Europe too, among white people, a fear of contamination, which is kind of a primitive fear, and it shows up during periods of hysteria, which is kind of why I'm more curious about the tensions in Canadian society. Perhaps all these open immigration policies have left white Canadians feeling like they're, a minority in their own country. I mean, are they?
No, I think Carleone is proof that HIV is the problem. It's not race. I mean, I think there's a racial aspect. Like if you're HIV positive and you're black and you're poor and you have sex with a lot of people, then you're going to be thoroughly demonized. But the
Mm.
majority of the demonization comes simply from HIV. So here you have Carleone comes from a fairly well-off family in Windsor. They're white. Italians are well accepted now in Canada. So there's really no undercurrent of racism. I think racism against
Mm.
Italians is well in our history. It
Right.
did occur at one time. But it's the HIV that did it.
Yeah.
If he had had syphilis or gonorrhea, or if he'd had nothing at all, there would have been nothing except, okay, here's a guy who went off the rails a little bit, snicker, snicker. He had a lot of sex and did some drugs, and nobody would have done anything about it.
Mhm. I guess my point about hysteria is more that it's more a more general thing that may arise from one area of society, say insecurity over, say, whites becoming a minority, and then it might spill over into other areas of insecurity, such as being scared of a disease. And it may not take on an ethnic character, and it may actually do that in many cases. As you said, two of these three that you talked about were black men, but just it might bring up a generalized fear that then spills over into fear of an epidemic when there truly is no epidemic.
No, I disagree. I think there is a fear operating, and it's totally different than what you're thinking. It is the problem really is America. And the reason why America is the problem is because Canadians, especially Canadian bureaucrats, are jealous that they're not Americans. Canadian
Seriously?
bureaucrats,
Really? Well,
yes,
they're always impressing on us how we should be jealous of them because they have clean cities and less crime and everything.
yeah. So imagine that you're in the Canadian military. The equipment you have is nowhere near as powerful and as plentiful as your neighbors to the south. So you really want to be an American general. You don't really want to be a Canadian general, except you were born in Canada. I'm a telecommunications expert, and so I've worked and I've seen that what happens is America says, "Gee, we should use this new type of wireless. Like right now, LTE is all the rage, and people are talking about 4G. That comes from the US. You know that it's going to be used in Canada. So imagine that you're a bureaucrat in Ottawa and you're trying to pick the next wireless technology. Well, you don't have to because America's picked it for you. So there's this real insecurity amongst Canadian bureaucrats. And under health bureaucrats, AIDS came from the United States. It's a big epidemic in the United States. There's still thousands of people being diagnosed every year. In Canada, it's a few hundred. It might even be under 100 people per year now. So there's this inferiority that we don't really have the excitement that's south of the border. So when they get a case like this, they have to make a big deal out of it because there simply aren't very many cases. There's
Yeah.
only around 100 new AIDS cases in Canada every year at present.
Well, it's a much smaller population too, and more diverse. I mean, more
No, no, no,
spread
no,
out
no,
too.
no. That doesn't account for it.
Really.
The per capita rate of HIV or AIDS in Canada is about 10 times less than the United States. So it's
Still
100 times
even,
less
yeah.
in total. But if you compensate for the approximately 10 times less population, it's still 10 times lower. So there basically is no AIDS epidemic in Canada. So every time a doctor or a public health worker gets an HIV positive case, especially an HIV positive person who doesn't do what they told, it's really, really exciting. And you got to get on this, and this is your chance to make a big stink.
It's kind of a boring place compared to here. Yes, absolutely. But and they think of it in some quarters as, well, that's a good thing. But I think in some cases there's an unconscious, wish to be us. That's kind of interesting. Having grown
Hmm.
up on the border, I know that, especially years ago, there was a sarcastic statement that Canadians used to use to say basically two different things, and it was called "keeping up with the states," otherwise known as "keeping up with the states," eh? And
I
yeah,
hadn't heard that, but
yeah,
I can, it resonates with me.
yeah. But that it's also it's sort of a statement that acknowledges that they want to keep up with the states, but also it's used in situations where, as you say, Canada adopts technology just because the United States did, or thinks there's an important issue just because the United States does. And some Canadians see through that and say, well, why don't we find our own way? And they say, well, you have to keep up with the states, eh?
Well, I think you used an active verb, like we Canadians choose a technology or we choose to get excited about AIDS. No, it just happens. Because it happened in the US, it's going to happen in Canada. If something
Right.
floods the airwaves on television in the United States, it will flood the airwaves in Canada because Canadians listen to American television stations. American media floods Canada, and it's
Yeah.
not the other way around. I'm sure people who live on the border pick up Canadian stations, etc. But if you're anywhere away from the Canadian border, you're probably relatively unaware that media even exists in Canada.
Yeah. Yeah, or even if you're on the border, I mean, you get a couple of news shows, Hockey Night in Canada, and a couple of
Right.
second-rate, sitcoms from Canada, and that's it. One of the things we got that we watched all the time was Second City Television, and that was it. That was all that was, the difference in volume coming out of the United States versus Canada, even if you're on the border, is still significant. It's still a significant difference. So we are the louder voice on the continent. I think a lot of our comedians and comic actors and things like that come from Canada. And Lorne Michaels, who produces Saturday Night Live, is actually a Canadian. And he once said, they asked him, why are Canadians so perceptive about the United States? And he says, well, it's kind of like living next to Imperial Rome. You're on the outside looking in, but you're constantly looking in. You're constantly noticing things.
Yeah, so I totally agree with that. And I think when it comes to irony, I think Canadians probably have a greater sense of irony than Americans because of their situation.
Yes.
But I do believe that bureaucrats know that in Canada they're not going to make big policy decisions. I mean, you can write all the papers you want on HIV in Canada, and they're going to be totally ignored south of the border. But if the CDC makes a big pronouncement on AIDS or SARS or whatever, it's going to resonate throughout Canada, and you're going to be getting people, your bosses coming to you and saying, how come we don't have that? How come we
Right.
don't have an action plan for whatever
Right.
the latest fad disease is?
So the way to really score points as a professional, especially a policy making professional in Canada, is to just echo something that's happening in the United States.
Yes, I mean, I think if I can use the exception that proves the rule, I think SARS was an exception where it was huge in Canada. Basically, Toronto was shut down during the SARS epidemic in 2003, and it never took off in the United States. But my analysis is the reason it didn't take off in the States is because that's when the war in Iraq started, almost
Mm.
at exactly the same time. So what would
Huh.
have been a big deal in the US, almost certainly, was just drowned out because the media focused on the war.
Now, I heard a rumor about that, about SARS. I don't know if you find this interesting or don't know whether it's true or not, but it was that it was something that the United States imposed on Canada. And in other words, just made this overwhelming hysteria that people are getting SARS in Canada and China, of course. But they picked Canada to pick on. So knowing full well that there would be cooperative voices there, the public health officials, because Ontario or Canada in general, I think it was just Ontario, was thinking of legalizing marijuana at the time, and that would have serious consequences for what Americans would expect.
I don't know. I think it was just hysteria um, uh, in Canada. And I mean, the SARS epidemic was, I've done quite a bit of research on this, was basically caused by the use of a nucleoside analog drug called ribavirin. And of course, listeners to the show that know that AZT is a nucleoside analog. So they treated every case of SARS with ribavirin and high dose steroids. And I looked at what was used, and basically, in Canada, they used higher doses of drugs than any other country. So Canada panicked, and they caused an epidemic of SARS. And when they realized that the medical establishment in Canada was about to destroy the Canadian economy, and I'm serious about this. I'm not exaggerating, Toronto was shut down. If it had gone on for another 6 months, Canada would have gone into a depression. I mean, basically, all business in Toronto came to a grinding halt. There were no conferences in Toronto. There was no
Wow.
tourism. They
Seriously, we
just,
didn't hear anything about this here.
no, because you were all hung up on the latest war, which Canada was not participating in. So there was a vacuum where the medical authorities were able to take the attention of the Canadian people, and I guess at some point they realized, wow, if we keep going like this, we're driving the Canadian economy off a cliff. So all of a sudden SARS stopped. It's almost like it was overnight. All of a sudden there's no new cases, and they stopped giving the drugs, and it all went away, and it hasn't come back.
Interesting. Now, what were they giving this particular drug for? It wasn't just for AIDS, it was for something else?
Well, SARS.
Oh,
SARS was believed to be the most deadly virus since HIV. It was incredibly infectious. There was one case in Hong Kong where they hypothesized that somebody with SARS touched an elevator button, and somebody later came into the elevator, touched the same button, and got SARS. They had no proof of this, of course, but it's the only way they could
yeah.
explain transmission between people in a hotel, people who had no contact with each other.
Well, leaving alone for the moment the fact that China is a country of over 1 billion people, and then they give us these strange reports about, the strange chicken virus or something, or H1N1 or SARS. I guess SARS was the chicken virus, causing 13 cases so far, and you're like, out of 1 billion? I mean, just to define that as an epidemic just boggles the imagination. So they had to come up with another country that had less people in it, I suppose.
Yes. Well, also, it's interesting that the lowest death rate was in China, the highest death rate was in Canada, and the richer Asian countries like Hong Kong, Singapore, Taiwan had intermediate death rates. And this corresponds with the dosage and type of use of the drugs. So in Canada, the drugs were injected. In China, it was oral, where you're obviously going to get less in your body.
Right. So
Um,
you're not saying that this drug caused the outbreak of so-called SARS, but it caused the deaths from it because it was being used to treat it?
Yeah, well, the definition of SARS was even more bizarre than the definition of AIDS. It was basically one respiratory symptom plus contact with somebody else with SARS, plus a fever that I think was 1 degree over the maximum range of normal body temperature.
So in other words, the latest flu epidemic in Toronto, which is probably a very flu-oriented place, knowing the climate there, wet and cold in the winter,
Right.
that you would get a number of people with these symptoms, at least one respiratory symptom and a fever. So there's your
And
SARS.
no, 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 no. You missed the one really important thing. And contact with someone with SARS.
Oh, well, that's
So it
not
was
hard either.
But yeah, you see, that's why it was almost entirely limited to healthcare workers because they had this massive precautions at the hospitals where nobody could visit patients in the hospitals, etc. So the only people having contact with people with SARS were nurses and doctors. And so they were the people getting diagnosed because they would get a cough or a fever. They'd go home with what people would normally call the flu. They would be diagnosed with SARS. They'd be put on ribavirin. And then what was a normal, case of what we might call the flu turned into this deadly disease called SARS, which was being caused by ribavirin and steroids.
Hmm.
So it was an iatrogenic disease. I mean, it started with something real, like a cough and a fever. But I mean, if everybody with a cough and a fever had a deadly condition, then the human population would be wiped out in a year because everybody at some point in a year has a cough and a fever. Well, not
Especially
everybody.
in places like Detroit or Toronto. I mean, these are
Yeah, yeah, it's
flu-infested places.
yeah. If you have one flu a year, you'd probably be considered more healthy than normal. So, in a big hospital, every day there's going to be a nurse out because of a flu. And in this case, if that nurse had been in contact with someone with SARS, even the most minor contact, passing them in the hallway, they would be considered a SARS victim and treated with these incredibly dangerous drugs.
Yeah. And as you say, this was a rare case of a Canadian-born hysteria. This was not a transfer of media news from the U.S. This was
Yeah,
typical. This
yes.
was very atypical and homegrown.
Right, and I think Canadian bureaucrats really want to have the excitement of doing something. So once they realized that they had the field to themselves, that the Americans weren't interested in this, they just went hog wild. And I think the same thing has happened in Canada with these HIV cases, where really the demonization and the treatment of these people is even harsher than in the U.S., which is famous for its harsh treatment of people who are accused of crimes.
Yeah, why do you think that's so?
Well, I think it's just the fact that bureaucrats in Canada have a built-in inferiority complex because nothing that they ever do is really going to get that much attention. I
Hmm.
mean, you can be in the Canadian military, you can write reports, you can acquire new weapons and whatever, but it's never going to be anywhere near as excitement as working in the Pentagon, where you might get like $1 billion, $10 billion, $100 billion program to build some new bomber or something.
Hmm.
In Canada, if you're lucky, America will let you in and let you buy some overpriced airplanes. The same thing with Canada and disease. Like, in America, you can invent a disease, and then all of a sudden everybody's talking about AIDS. In Canada, you could invent a disease, and, you know, next week everybody's forgotten it.
All right. Huh. Interesting. And I hadn't known that it almost shut down Toronto. As you say, we had again, we had more exciting things happening here. We had the war in Iraq starting. So
Yeah,
um,
I think you need to think of a trajectory of a disease, kind of like shooting off a rocket. And what Canada did was they gave the rocket so much energy that it left the Earth's orbit and disappeared into outer space within a period of less than a year. By July that year, so between March and July, the rocket had like gone. Whereas other diseases like West Nile virus never get enough liftoff, and they're always like limping. And every once in a while, it sort of gets off the ground for a couple of months, but then it
oh,
goes back again, and everybody forgets about it. AIDS is the perfect example of how to put a disease in orbit because it just keeps going round and round and round. They managed to make it severe, but not too severe. It's
uh-huh.
deadly, so it gets your attention. Everybody's going to die of it eventually, but you don't die too quickly. So it's not like, everybody who had AIDS today is going to be dead tomorrow, in which case you say, well, obviously there's nobody left with HIV, so it's not a problem anymore. So they just hit the sweet spot with AIDS, and they haven't really managed to do that since then. But SARS is
Mhm.
one of the few examples, I think, of a disease that had too much energy and therefore left the universe.
Right. Well, the way things are going, they're going to keep hitting that sweet spot with AIDS in Canada. At least that's the intention, because nobody's challenging this test in court. The real danger for that sweet spot, or that that wonderful floating around in orbit, free joyride that you get for funding and everything for a disease like this, the real sweet spot in that is keeping it going. And when we're talking about HIV criminalization laws, I mean, at all costs, you must keep it going. So
Well,
all manner of irrationalities will be supported, and I think you've described that in this interview.
yeah, and I think, the nice thing about putting something into orbit is it takes no energy once you got it there. Now, that's kind of a bit of an exaggeration with AIDS because it takes all the money you spent last year plus $1 billion is what they spend on AIDS every year in the United States. So they're burning a lot of gas to keep AIDS going. But really, it's much less energy than it would be to lift off another disease. And in most cases, it blows up on the launch pad or it just doesn't make it into orbit. But with AIDS, they've got it there. And all of these criminal cases are important at keeping the fear alive. And so that's why I think fighting these cases is very important. And I really keep my eyes open for cases in Canada where maybe OMSJ can get involved,
Yeah.
find the right lawyer, the right defendant, and get one of these legal cases challenged in a substantial way.
Right. Yeah. I mean, we should make a distinction here between the calls for HIV decriminalization that the mainstream AIDS organizations are calling for. That is, taking these laws off the books or making them less obtrusive, and the work that OMSJ is doing, which is actually defending individual cases based on the the inability of the HIV test to withstand expert scrutiny on the witness stand. So these are two different things. One of them is a last-ditch attempt. This decriminalization is a last-ditch attempt to keep this thing in orbit, to keep it going, because, as you say, they would love to keep the excitement going of these criminal cases, but that being not possible, if it's going to keep dying a death in court with the HIV test being challenged, they'd rather just keep the hysteria going outside of court, and they'll settle for that. But what OMSJ is doing is incredibly radical, and it
Hmm.
is sounding the death knell for the whole AIDS paradigm and all the funding and all the treatments and all the scientific uh, apparatuses and basically all the social control. It's really really sounding the death knell.
And I think that we have a big advantage over the AIDS establishment because their argument is really self-contradictory. I mean, they basically say it's a deadly illness that everybody's going to die of it. But these drugs can save your life, but they don't really save your life, and there's really no side effects. But when people get side effects, they have to change their drugs. They're just full of contradictions. It's not a very convincing story that they can come up with because they don't want to give up on the idea that HIV is universally fatal, that it
Yeah,
requires lifetime treatment. And so they're caught by their own dogma, and they just can't come up with a story that's going to really convince a judge that, oh, okay, so HIV is treatable now, so as long as these people stay on their medications, we can let them all out of jail. It's not really working too well.
right.
I don't think they like to think of themselves as harsh people like Mark Wainberg, who seems to be kind of an uptight kind of guy, has spoken out against criminalization.
Yeah, Mark Wainberg being the leading researcher at McGill University in Montreal, correct?
Right,
Right.
that's correct. Former president of the International AIDS Society, and a big shot in Canada. He seems like a very angry person, especially if you see Robin Scoville's movie with an
Oh, he
interview
walks
with him.
out. He walks
Yeah, he
out. It's
walks
so
out.
cute. Yeah,
But he tried really hard to say, oh no no no, we didn't want you to be putting people in jail just because we called this a deadly disease that's sexually transmitted. We didn't want you to take the logical consequence of that is
right.
that if you have sex, that you are killing somebody.
Well, there's the contradiction in they would like to paint themselves as civil libertarians. Yeah,
Nice people who are just trying to help other people, and we don't want to be throwing our patients in jail.
right.
Uh, Yet they can't really come up with a good story. And I think OMSJ is saying, gee, this person's not really HIV positive. There's no HIV in this person's body, and some other fundamental arguments. Having uh, expert witnesses self-destruct on the stand when they can't answer simple questions. I think this is a strategy that can really convince a judge. You get some big shot doctor who refuses to get on the stand or who sort of melts down when he's faced with
Mm.
relatively benign questions, then you can get somewhere in these cases.
Right. Better not to put it on the stand from their point of view. Better not to take it to court, not to so all of a sudden they're concerned about civil liberties and people being trampled on like this. It was interesting in a previous How Positive Are You? We interviewed Mark Gabrish Conlon of California, a longtime activist on this, and he said that there's this rift in the different stories between the treatment and prevention wings. The prevention wing wants you to think this is a deadly virus and you should do everything possible to prevent yourself from getting it. And people should go to jail possibly by that logic. And and the treatment wing says, oh no, we've got it under control. The drugs are so much better now that you don't even need to consider it a deadly virus. People are living with HIV, that myth of living with HIV, that, oh, you can
Right.
live a normal lifespan. So why charge people with life imprisonment, sentence them with life imprisonment for, first degree murder for, with a deadly weapon? It just seems they're not getting their story straight. And then the story that they're trying to get straight about HIV criminalization is they're trying to take the treatment wing's point of view that, hey, now that we can just keep viral loads low, and not even explaining what viral load is, which is an absurdity. now that we can do that, and now that we have these great drugs on the market, which we don't, we know the effects of those. Now that we've got all this, we'll just reinforce our own myths about viral load and drugs by saying, look, you can't criminalize this anymore. We're all good with people going free.
Well, so far, it hasn't worked. There was one of the things the Supreme Court mentioned, there was a Dr. Smith who wrote a report. He mentioned that in Switzerland, they had said that they believed that if people were on the drugs, had a low viral load, that they were essentially uninfectious.
Right. It's really shoring up their own propaganda.
But the Supreme Court didn't accept that. They said there's still a risk of infection. And so unless you are of low viral load and using a condom, we're not going to accept that. So it's an incredibly harsh standard in Canada.
Is there a similar movement as the mainstream AIDS organizations in the United States? Is there a similar movement in Canada to repeal these laws or these precedents?
Well, the AIDS establishment in Canada is fat and lazy, and this requires a lot of concerted energy to put into legal cases. So there's a little bit that's happened, but I think most AIDS service organizations in Canada are quite happy to give out condoms, do a little bit of counseling, pocket most of the money, and not really stress themselves.
We're not asking that they get involved in cases. They're not doing that here in the United States, except for OMSJ. But is there any comment against these laws, like legislatures and Parliament?
There has been some, but if you're going to get it into Parliament, you have to do a lot of lobbying. I mean, you're going against the grain, especially since our government is a right-wing government that essentially contains a lot of homophobic people. If you start talking about AIDS, they're gonna say, yeah, just throw the bastards in jail for the rest of their lives. That's their knee-jerk reaction. So you're not going to get anywhere unless you spend a lot of time educating them. And a lot of the AIDS activists are gay men. You've got to lobby a right-wing government. It's going to be a lot of work, because you're dealing with people who, there's a mutual distaste between the two groups, and nobody's really done that work to argue the mainstream approach that we need to change laws, that we need to say this. And the Conservative government has also got a very strong religious right component to it, and they're going to say, why should we be making it easier for people to have sex? Maybe we should just outlaw sex, because that's the way we like to think about it.
It's strange because, here in the United States, we think of religious fundamentalism as a kind of southern U.S. phenomenon, mainly. And yet Canada is this, sort of polar country, polar bears everywhere, right? So it's hard for us to think of Canada as having this fundamentalist element to it, but it very definitely is there and very definitely helps make policy in Canada.
Well, yeah, it's just the current political climate, because the left in Canada is split between 3 or 4 different parties. The right is a lot more united, and amongst the right, the religious right is a relatively small but vigorous component. And so they have a fair amount of influence, although I think they've discovered that it's kind of illusory, because the Prime Minister knows that if he starts trying to say, for example, ban abortion, like abortion's legal in Canada, if he tries to ban abortion, he's going to get the left united and against him. So he refuses to let the religious right actually accomplish anything. But I think they still do have a lot of power, and if somebody came up with a law to decriminalize HIV, I think it would die. It just wouldn't happen. So I think the approach of trying to get the experts to back out of the court cases is a way for the establishment to save face. It's a way to relieve HIV-positive people from the burden of criminalization, and it will weaken the AIDS establishment. It's one battle that they lose. They have to step back, and then Canadians take HIV a lot less seriously because they don't see these criminal cases. They don't see the demonization of people. They see another side to it. So I think the criminal cases are extremely important. Yeah. And besides, if you can eliminate criminalization of HIV, what it means is that the vast majority of HIV-positive people can live a more normal life because they're not fearing that they're going to be thrown in jail anytime soon. It basically leaves HIV-positive pregnant women as the group against which receives the most human rights violations.
Hmm.
That doesn't really that's not really benefiting from decriminalization of HIV.
Uh, so, what are the chances of finally convincing a defense lawyer or defense team to actually take this approach? I mean, and what would it take to convince them of that?
Well, I think it has to be a defendant who has some understanding of dissident arguments and a defense lawyer who's a little un-Canadian, willing to step outside the crowd and have their own opinion. So those are two things that are a little bit unlikely, but given that there's a continuous stream of these cases, it will happen eventually that we will get the right lawyer and the right defendant, and we can fight one of these cases. And then I think it's going to get really interesting.
And you're continuing to monitor this and contact people?
Yes, I'm in. My biggest source for criminalization of HIV in Canada is Carl Leone, who phones me from jail quite frequently, and he spends a lot of time reading the newspaper. So he will see all these new cases. So he'll phone me up and say, "Hey, have you heard about John Doe? He just got arrested in Winnipeg and is charged
Mm-hmm.
with whatever." And so then I'll follow it up and I'll send Carl information and try to figure out if it's the right case. We haven't found it yet, but we keep looking.
Okay, so HIV positive Canadians who are concerned about this issue, who want to help, or who are facing charges themselves, they might give you a call. You're at the Alberta Reappraising AIDS Society, and you do have a website. It's called aras.ab.ca. .ca is websites in Canada.
Yeah.
aras.ab.ca. And you are the go-to person for this in Canada, as far as I understand.
Well, yeah, I don't think there's anybody else who's really actively looking at criminal cases except for Carl Leone, and being in jail, it's a little hard for him to do anything about it.
Well, it's
So
a
people are,
small but growing field, David.
yes, so
Let's
people are
start with
welcome.
one guy.
Yeah, well, people are welcome to contact me if there's a case that I could persuade Clark Baker to get involved with. I'm happy to talk to the lawyer. We've
Yeah,
tried.
Clark Baker being the head of OMSJ in the
Yeah,
United
yeah.
States, yes. And you also have a hotline of some sort, like a toll-free number that people can call for information from your organization?
People can call my personal toll-free number, which is 877-289-6609.
Okay.
And that's anywhere within North America. They can call that for free.
Okay. And you also receive a lot of calls from Europe and other places, including Africa and the United States, correct?
Well, probably more emails than calls, but yes, I get emails from around the world, people who are worried that they might be HIV positive, people who've just been diagnosed HIV positive, mothers. I get quite a few different cases and try to help people by giving them information, not telling them what to do,
Right.
but just giving them information.
Well, you've told me a smattering of your calls, and they are just heartbreaking. I think that if people knew the work that you and a few other people do on this and actually taking the calls, I think our image as dissidents would be anything but out of touch with people. I think people would see us through the work that you do as compassionate, as concerned, as truthful, and helpful to people worldwide. And I thank you very much for that work. What would we do without David Crowe?
Well, thank you. That's very kind.
Yes.
It's been great to be interviewed by you, Beth, and it's a little bit of a strange situation to be interviewed on my own podcast, but it was fun.
Yeah.
And I'm
Well,
glad you
someday I'll
suggested
ask
this.
the same favor of you.
Yes.
In closing, I'd like to ask people for their feedback through our website, our Twitter account, our Facebook page. You can get all this information at our centralized webpage at howpositiveareyou.com, or send us an email at info@howpositiveareyou.com. In fact, send us that email right now if you listen to this and you liked it or you have further questions. We also ask occasionally for donations of time and money. We run this on a shoestring. Right now we're looking for an audio editor. We've got a couple of people in mind, but please let us know if you have skill, especially with GarageBand. Maybe an interview arranger, someone to help arrange our schedules so that we can actually interview people in different time zones. It requires a lot of our time and effort. And please do consider making a donation, however small or however large, through our website. We do have a PayPal account there, correct, David?
If people want to make a donation, they could make a PayPal donation through aras.ab.ca. They could send a check. They can contact me for other methods to accept payment. But yeah, we would be very happy. There's probably some more equipment that we should buy so that we can do better podcasts.
Yeah.
And various expenses. So it would be great if people could sponsor this, and we are interested in accepting advertising that is compatible with the mission of howpositiveareyou.com. So if you want to sell AZT, probably this is the wrong place. But if you're an alternative health practitioner, or you sell health supplements, or you somehow help people live a healthy life without the wonders of pharmaceuticals, you'd be welcome to discuss having an advertisement.
Yeah, well, let me put it this way. If you want to sell AZT or other latest AIDS drugs on our show, we'd be happy to. We would be happy to accept your money. At least I would. But we will list the full list of side effects at the end, just like you do on network TV. So
yes.
I think that's fair, isn't it?
Yeah, and we'll read them really slowly, not like on TV where they read them so fast you can't hear them.
Right, with the picture of a woman walking in the woods with her dog or something.
Yeah, like maybe we'll put up a picture of somebody with Stevens-Johnson syndrome or something like that.
Yeah, so feel free to contact us with that your advertising dollars. Anyway,
yes.
Until then, I say goodnight to David Crowe. I say goodnight to our audience, and please be well.
Thanks, Beth. Bye.
Bye.